Just in time for Christmas, international travel red lists and COVID no-go zones are back for a second straight holiday travel season.
Now the circumstances become unpredictable again, right?
Sounds like a bit of an omen for future problems like we've seen in the previous year.
Europe's travel industry had just gotten airborne again, but with surging infections and much of the continent already either in lockdowns or contemplating them, the EU was one of the first to ban flights from southern Africa.
They should be suspended until we have a clear understanding about the danger posed by this new variant.
Hundreds of passengers arriving in Amsterdam had the ban imposed mid-flight, so they were stuck for hours when they landed, waiting for PCR tests to be cleared. At London's Heathrow, they were luckier, landing just before Britain's new restrictions kicked in.
I feel extremely relieved because, who knows how long this is going to last.
In South Africa, though, the measures were met by anger from government officials who called them premature.
The reaction of some of countries in terms of imposing travel bans and such measures are completely against the norms and standards as guided by the World Health Organization.
I think most governments...
This British travel industry rep urged people not to cancel their upcoming travel plans and just see.
I think it's inevitable that along the way you're going to get situations which will crop up where, that will go back a step, but hopefully it's only a short-term issue.
While the flight restrictions are limited to southern Africa, the fear, of course, is that they could be expanded if the variant spreads rapidly in other places. Chris Brown, CBC News, London.
And let's go back to Dr. Isaac Bogosh and travel bans. Dr. Bogosh, are they effective?
I know there's such an urgent need to do something, but often travel bans, especially focused travel bans, are largely ineffective. We've heard about travel bans to Southern Africa, yet we've also heard about cases that have popped up in Hong Kong, in Belgium, in Israel, and other parts of the world. Especially, you hear about this case in Belgium. This was a woman who traveled from Egypt through Turkey back to Belgium with no contact at all to Southern Africa. So I think we have to ask ourselves, are travel bans, especially focused travel bans, really going to be that effective in preventing the spread of this infection and this variant? It's unlikely to be.
All right. Well, we're going to have a longer chat, both with you and Dr. Susie Hoda, a little later in the program on travel bans and many of the other questions that have come up today. Thanks.
My pleasure.